Live from the Washington, D.C. area, it's the Inside Scoop, Emerald Planet. All the ecology news that our viewers want to know. Now, here's your host, Executive Director of the Emerald Planet, Dr. Sam Lee Hancock.
Welcome to the Emerald Planet as we come to you from Washington, D.C. in the United States as we look around the globe in 144 different nations, looking for those 1,000 best practices, the technologies, the services, and the products that are making a difference as we move through the 21st century. And as we add 2 billion new people to the planet, we have to look at the basic infrastructure, the roads, the water, the electricity, everything else is needed, but also the healthcare and education. And we're going to be talking about a very unique program as dealing with heart patients throughout Latin America, and is actually very profound in saving the lives of almost 15,000 people. And so this is definitely a best practice. I have sitting right beside me Mr. Michael Maniscalco. He is actually has a lot of titles. He's the Chief Operations Officer, COO, Chief Compliance Officer, which in the work that you're doing is very important. And this is called Heartbeat Foundation International. And Michael, welcome.
Thank you very much.
Glad to have you here. This is a really interesting name, Heartbeat International. Tell us a little bit about this name and a little of the history of the organization.
Well, we're a 30-year-old organization, nonprofit organization based in the United States. All of our work is done outside of the United States. We were founded because there are over 1 million people each year in the developing world that go without a pacemaker. These are people who either die or lead a severely compromised life.
And this pacemaker is something for the heart, right?
Yes.
For the uninitiated.
It's an implantable cardiovascular device that helps regulate the heartbeat. And there are various reasons that a person might need a pacemaker. But we exist because we exist to try to fill that void, to try to address those 1 million people who are going without a device every year.
Yeah, looking at this, the very interesting thing that you shared with me, that this actually grew out of a Rotary International project. And you know I'm a very active Rotarian, the Rotary Club of Washington, D.C. We have about almost 30 different projects around the globe, but having the local Rotary Club to be involved in this, tell us about this origin of Rotary being involved, and now this is morphed into something that's truly international.
Well, we were founded by a physician from Guatemala, a cardiologist from Guatemala, Dr. Federico Alfaro, and his professor at the Texas Medical Center, Dr. Alfaro, when he was training at Texas Medical Center, with Dr. McIntosh, had an experience where an 18-year-old patient in Texas got a pacemaker the very next day. A week or two prior to coming to Texas, Dr. Alfaro had to watch a similarly aged young man with the same condition die because there was no way to get that.
That is incredible. What a story.
Yeah. So when Dr. Alfaro returned to Guatemala City, he went to his Rotary Club, Club Rotario de la Asunción in Guatemala City. And they immediately latched on to this as a service project that their organization would take on. Dr. McIntosh and colleagues helped arrange the first donation of pacemakers from a company called Intermedics, which is now part of Medtronic. And once it got up and running in Guatemala, it spread by word of mouth to other Rotary clubs all around the world. At one point, we were operating in 29 countries. All through local Rotary clubs in those countries and cities. Yeah,
and this is something that many people, if they're not actively involved with Rotary, don't really understand that even though Rotary International has 1.4 million members, about 34,000 clubs, most of these projects, if not all, actually come through the local clubs. And so this is something that's very important as a catalyst for all this. But you've, as I said in my opening, you've saved almost 15,000 lives since 1984. I mean, that's a huge number of people, even though the need is much greater than that. Still, 15,000 people are walking around because of the work that you're doing. So how were you able to morph from this one project in Guatemala City into all these other countries and this number of people?
Well, Heartbeat International is really part of a chain of organizations and individuals that very thankfully have a strong humanitarian outlook. And we help, I hope, we help organize effectively all of these pieces into an effective chain to deliver these devices and the associated medical care free of charge to these indigent patients. So on the one side of the chain, you have the global medical industry that donates products to us. And on the other end of the chain, you have folks like Mr. Garcia and Mr. Hussein, who we're going to talk to later today, who are on the ground in their countries, working every day to find patients, qualify them economically, and arrange proper medical care that is performed by the talented physicians resident in those countries, carrying out our mission every day.
Yeah, and what you're doing through Heartbeat International, you're coordinating with local people with various titles, but they're actually working in, as you're talking about, Mr. Garcia is in Mexico,
yes,
and then Mr. Hussein is in Trinidad and Tobago, and we're going to be talking about those different countries and the difference between those. But you save about 500 people a year. That's a significant number. But what needs to happen in order to save even more people? Because you talked about, what was it, 1 million people around the globe that annually need to have this kind of service, and we're doing about 500. Significant number, but many more to go.
There's plenty of opportunity if you want to look at it from that perspective. I think that the biggest challenge we have won't surprise anybody. It's a financial challenge. Those locations that are able to raise funds in their country successfully and hire somebody to spend to give their full professional attention to the Heartbeat mission are those that are most successful in terms of sheer volume. This is a big challenge for us in securing the financial resources we need to carry out the mission. If we could have at least one full-time person in every place that we operated, our numbers would go up significantly. The other challenge we face is maintaining an inventory of devices diverse enough to manage all of the regulatory and other hurdles that we have to manage in order to get a device to a patient properly.
And that device, I guess, that needs to be size and age appropriate and all those kinds of things. Is that some of the parameters of that? Or are there other parameters that deals with it, about how many chambers of the heart and those types of things?
Well, all of those things are part of what goes into this mix. So we are fortunate enough to receive different types of pacemakers that may have one chamber or two chambers, and even internal defibrillators as well. But various countries it's easier to send devices they have more forgiving regulatory environments than others. And the manufacturers have their own limitations on where we can provide devices based on their own set of concerns that we have to manage and deal with as well.
Yeah.
So we've got, please.
Yeah, I was going to say, just looking at these photographs we have here, the ages that you have, male, female. But tell us a little bit about this photograph right here. I think this picture almost tells all. Just tell us a little bit about the history, but maybe the background of what's going on here. How do you intake these people? Sure. How do you determine, when they're going to actually get their pacemaker, and then how long do they have to stay in the hospital? These kinds of things.
This is a patient from the Philippines, from Manila, from the Philippine General Hospital. Our physician there and folks at Heartbeat International of the Philippines have publicized the program to the cardiology community. So when a cardiologist identifies a patient that needs a device but cannot afford a device or does not have access to one through a government program, hopefully that physician knows about Heartbeat International of the Philippines.
So Heartbeat then becomes a safety net for these people, hopefully within these various countries where you're operating. Okay,
yes.
Go ahead.
Yes, so Heartbeat of the Philippines will be contacted. The patient will come and visit with our people there. Their economic status is reviewed by a social worker or a similar professional. The medical director of Heartbeat of the Philippines will verify the medical need, and the administrative people will arrange for the procedures to be performed. And then, of course, the doctors who work with us will donate their time and talents to perform the surgery.
Now, looking at this situation right here, so you said this is both government and also could be for-profit hospitals, or it could be humanitarian hospitals, such as through Catholic Charities, or these kinds of things.
Yes.
So it's really a mix of various resources that you're using. So how do you, in your relationship, how do you manage this mix? I mean, there's a lot of moving parts in all this just to get the patient into the hospital and have the device installed.
Well, this is why it's so important to emphasize that we're operating on the ground 365 days a year in each of these countries. The operations are carried out, the administration of the Heartbeat mission is executed by local professionals in their countries. They know the groundwork, they've got the contacts, they're there every day, and they can do the things that need to be done to bring all these pieces together.
Now, looking at the difference, let's say, looking at Mexico, large country in Latin America, very sophisticated middle-income country. And then you have Trinidad Tobago, much smaller, but still similar as far as the finance is concerned. It's in most terms a fairly wealthy country, but still much smaller. So what's the difference? How do you manage the difference between this? And then how does that all fit into the schema as far as Heartbeat International is concerned?
Well, probably, the biggest difference that you would notice between a large country and a small country is just the number of institutions and hospitals that would have the infrastructure needed to perform a procedure like this, the number of physicians qualified to perform the procedure is going to be larger in a bigger country as well. That is not to say that in a smaller country you don't have excellent physicians. We do. We obviously do, especially in a place like Trinidad. It's regulatory environments and cultural issues that sometimes play a bigger role than the population might of a given country. Pakistan might be a good example. Pakistan is a very large country population-wise. But they have certain cultural issues, especially in certain parts of the country, that make it difficult to deliver the Heartbeat mission, especially when it comes to verifying the indigence of the patient, which is a critical step that we have to follow.
So looking at all this, and we're absolutely running out of time. We've got about 30 seconds or so left. What do you see for the growth of Heartbeat International over the next 5, 10, 15 years? What do you see, Michael?
It's going to be an expansion into additional cardiovascular devices, heart valves, stents, and the like.
And also, I think catheters are going to be added to that,
as well.
Right?
And perhaps even more importantly than that, for the long-term mission is the contribution to education and training that we want to make so that we can decrease the number of people who need a pacemaker. The bigger bang for the buck is in education, capacity building, and in educating the public about how to maintain sound cardiovascular health.
That's absolutely fantastic. Well, thank you for being with us. This is Michael Maniscalco, who is the Chief Operating Officer and the Chief Compliance Officer for Heartbeat Foundation International, and talking about what's going on in various countries in Latin America and others as we look around the globe to create the Emerald Planet.
One day these rats were playing in the woods. Well, it's a matches and that's no good. Yeah. Listen to smoke before you give it a try. Only you. Don't play with matches. Don't play with fire. Cause there's nothing very funny about nothing very nice on a homeless mind. So if a gorgeous force is what you desire, don't play with matches. Don't play with fire. Yeah.
Only you can prevent wildfires.
Fire.
Why don't you just wash your car at home?
When I wash my car, everything runs down the street and down into the storm drains. With all the chemicals in the soaps and waxes, the last thing I want to do is poison my own drinking water. At least here, it's all contained and recycled on site. That's why I also take my car in for oil changes instead of doing it myself. I might take a chance on spilling stuff. You know what the best part is?
What?
More time to kick back and watch the game.
How far would you go to protect the planet?
I want you to build an ark.
Here we go. Okay, that's good. Oh, okay. Ow!
Maybe there's another way.
People, the flood is imminent!
Is it too much to ask for a little precipitation?
Go to fightglobalwarming.com to find out what you and your community can do to reduce global warming pollution.
Somewhere around the world, there are men and women of the armed forces risking their lives, helping rebuild communities after natural disasters, collecting toys for needy children, tutoring kids in school, These are your sons and daughters who work to keep us safe, secure, and free. Dedicated men and women who put their country first.
We're back to the Inside Scoop Emerald Planet. Here again, your host, Dr. Sam.
Hello and welcome to the Emerald Planet as we come to you from Washington, D.C. in the United States as we look for what we call the best of the best, 1,000 best practices, the technologies, the services, and the products that are making a difference as we move through the 21st century. And as we go to a planet with 9 billion souls by 2050, how we're going to be able to take care of all these people and provide the basic infrastructure and at the same time the health care and the education, and in many cases the combination of those two to bring about an even higher quality of life. As you know, we have over 1 billion people on the planet that are constantly at risk, sometimes depending on water, sanitation, maybe even half of the world's population today, almost 3.5 billion, and we need to be able to add 2 billion. So with those 9 billion, how are we going to increase the quality of life? We have someone in Trinidad Tobago is actually working on this issue in healthcare, and also the gentleman is sitting right beside me, and we're going to be talking with these two gentlemen about what's going on. As far as the organization, it's called Heartbeat International Foundation. We have Farouk Khan Hussein, who is the program manager, who is and coordinator in Trinidad Tobago, and this is through the University of the West Indies, I understand. And then sitting right beside me is Michael Maniscalco, who is the Chief Operating Officer and the Chief Compliant Officer of Heartbeat International Foundation. And Michael, while we're waiting to get Farouk back on Skype, what is this Chief Compliance Officer? What is the duties of that, and why is that so critical as far as these implants, as far as the heart monitors are concerned?
Well, Heartbeat International has instituted a set of operational policies that are based on best practices, a term that you like to use, that we've seen at our heart centers. So we want all of our heart centers to emulate what our most successful heart centers are doing. Trinidad and Tobago is our most successful operation. And they do a lot of things that we are working to have all of our other heart centers emulate in their countries.
So they really are the best of the best then as far as what's going on through Heartbeat International?
Well, they do the most implants every year. At least they have for the last several years. This year they're already well over 100 procedures for the year. They will do about 25% of our total procedures for the year across all of our international locations.
That's really interesting. Now, Trinidad Tobago is a very small country vis-a-vis Mexico, Pakistan, the Philippines,
yes,
where you're working, and yet they're doing that number. So it's not really the numbers of people within the country itself, but it's based on the sophistication, the availability of heart centers and all that within these countries?
There are a lot of factors that go into this. You've hit on some of them. One of them is the ease with which we can keep them supplied with devices. That's a very important one. That's not a significant challenge for us in Trinidad, as it is in other countries.
Mm-hmm.
So that makes a big difference. But it also has to do with the organization and the effectiveness of how that organization is run.
I see. Okay.
Sure.
Mr. Hussein, I understand you're back with us from Port of Spain and Trinidad and Tobago?
Yep.
Glad to have you. Welcome. And understand you're the program coordinator.
Yeah.
You're the program coordinator there in Trinidad Tobago. Tell us a little bit about Heartbeat International Foundation and its operation in Trinidad and Tobago, which is in the Caribbean.
Well, Heartbeat International, of course, is humanitarian and charitable by design. In Tobago, right now, we follow the HPIF mission with its purpose, its primary purpose, to provide the free pacemakers and defibrillators in the general citizens. We have basically, I don't want to say revolutionized, but we have evolved over the years where the process and procedures and the practices are concerned in providing the donation of these devices on a humanitarian basis to the indigent population. And it's because of this process and these procedures that we have been successful, along with the humanitarian generosity of the human resources we have within the organization.
Well, I understand, actually, Michael's sitting right beside me, who's the Chief Operations Officer, Chief Compliance Officer for Heartbeat International. And he was just saying very good things about your operations there in Trinidad and Tobago, and saying how you really are exemplary as far as the best practices. What are you doing, Hussein, that's different maybe in what's going on in other countries? And how have you established yourself as, you know, this example of best practices which can be used by Heartbeat around the globe?
Well, as the organization evolves and the process evolves in actually screening patients and providing the service to patients, what we do is we try to keep one step ahead. And that is by ensuring the organization evolves with it. And again, one of the main things we have a very active board of directors and a very supportive membership within our board, which are members of the Rotary clubs. We even have members who are Lions clubs within the board of directors within Heartbeat in Trinidad and Tobago. And this has been able to give us far-reaching extent to our humanitarian services in the country here.
I see. Okay. Well, I'm going to switch over. Michael's going to ask the next question as our special guest here in the studio.
Sure. Hi, Michael.
Hi, Farouk. It's nice to see you again. Could you tell us a little bit about the recent implant of the 100th patient for 2014?
Yeah.
Can you hear him, Hussein?
Yes. Of course.
Yeah. Let me go ahead. Can you hear me, Hussein? Okay. It's very slow. I'm going to. Let's let.
I'm here perfectly.
Okay, we're losing you, Michael. Let's go ahead.
Properly.
No, we really can't. Michael, go ahead and just tell us a little bit about some of these best practices that Hussein was talking about in Trinidad and Tobago, and why through Heartbeat International, why you feel that, you know, this really is kind of the pathway that you want to take all these other countries in the future.
Well, one of the key things that he did mention was they have a very active board of directors, which increases the strength of the connections that they have with the health institutions in Trinidad, which has resulted in some very positive things, such as being able to reserve space on the calendars in the cath labs to do a high volume of patients. They've just completed their first of 3 implant runs, where over the span of a single week, they provided these devices to 25 indigent patients. They have 2 more runs coming up between now and the end of the year. So to be able to get that space and the time in the cath lab reserved for the Heartbeat mission is critical to the numbers of patients that they're able to serve.
Yeah, and really, when you're looking at over 1 million people that need this kind of operation, and even with 500 within a year, still there's a tremendous extra need out there. So it's really great that you're doing this. Looking at the operation Trinidad and Tobago, that's a very sophisticated society. I went down, spent about almost 2.5 weeks there, and had a chance to travel around, and I think I interviewed almost 100 different people while I was there. So I really enjoyed that. But as far as the echocardiograms and all these other things, what is about their hospital system there and this collaboration with the Ministry of Health that's really helping to propel them to have over 1,000 patients within this system already?
Well, I think it's the strength of the personal relationships that have been established over the years. I think it's a good track record of success. One of the things that we at Heartbeat International try very hard to do is to assure that every patient is followed. Once the device is implanted, it needs to be monitored periodically. The battery in the device will decline over time. It's important to know when that day is coming so that the device can be removed and replaced, for example. And we are getting reports from our colleagues in Trinidad all the time of pacemakers that had been implanted 5 or 6, 7 years ago that are now being replaced with new devices. So being able to provide that type of service on a continual basis, I think, really helps to establish the goodwill and the good relationships that can build on, and that can lead to further success and further goodwill.
And looking at the collaboration you have in Trinidad, we understand that part. You're working with the Ministry of Health and with possibly the University of the West Indies, which I actually collaborated with a number of years ago myself. But in the United States, I know that you have a feeder system as far as these almost becoming past-dated heart machines that are being used overseas. How does that work? How do you get those? And then why is it important to the manufacturers here to have someone like Heartbeat International to be able to take these and then distribute these abroad for free?
Well, I think the manufacturers, they all have their own corporate foundations, of course. They're doing a lot of good work outside of what they do with Heartbeat International, whether it's funding cardiovascular research of different kinds. But the devices themselves, when they're nearing this expiration date, are still good for years, for many years. And I hope that Heartbeat International provides a good outlet for them so that they can be assured that the device is being used to serve the needs of an indigent patient, as opposed to being scrapped and going to waste.
Well, let me ask this one last question because we're running out of time, but Trinidad Tobago is a regional distribution center as far as Heartbeat International. Tell us the significance of having that in TNT and being part of this 20-nation area called the Caribbean.
Sure. Well, the distribution center houses our inventory, and that's important because when that use-by date is reached, if that device is in the United States, it has to be destroyed. So if we are able to house the devices outside the United States, and they're still good for years, this is very important.
I think that's something we need to emphasize. That's not something that's past dated.
They do not need to be destroyed, and they can be distributed to our other locations in accordance with the laws of those countries, and that's one of the things that I have to manage to ensure that that happens. This allows us to make sure that these devices are used to save lives of others who would otherwise perish.
That's absolutely incredible, and we're keeping it out of the landfill, and we're not wasting these precious resources that have been used to develop and all that. Well, we missed Farouk Khan Hussein, who's the program coordinator for Heartbeat International Foundation. Could not bring him in by Skype, but we had Michael Maniscalco, who is the Chief Operation Officer and Chief Compliance Officer, as we look around the globe to create the Emerald Planet.
And for those who haven't started, there are still things you can do to catch up.
Oh, that is good news.
Like getting out from underneath past debt. And don't get wrapped up with high-interest credit cards.
Get you some eyes.
Be diversified with your investments. Don't put all your eggs in one basket. Your financial goals are not out of reach. The choice is clear. For a happy ending, choose to save.
Everyone with alcohol and drug addiction is in the same boat. With treatment, you can find solid ground. For drug and alcohol information and treatment referral for you or someone you know, call 1-800-662-HELP.
Dude, are you sure you want this tattoo? Because just do it.
Some mistakes in life are permanent. Like hearing loss. To learn how to protect your hearing, visit ASHA.org.
You've probably heard about heart disease, but did you know that it's the #1 killer of women nationwide? Heart disease claims more lives each year than breast cancer, lung cancer, or strokes combined. But there are steps you can take to protect yourself against it. For more information on how you can prevent heart disease, contact your local American Heart Association or visit their website at www.americanheart.org.
We're back to the Inside Scoop Emerald Planet. Here again, your host, Dr. Sam.
Hello and welcome to the Emerald Planet as we come to you from Washington, D.C. in the United States as we look around the globe in 144 different nations looking for those 1,000 best practices, the technologies, the services, and the products that are making a difference as we move towards and through the 21st century. And as we have a plan of 9 billion souls by 2050, and possibly it could grow to 12 to 13 billion by the end of this century, how we're going to be able to take care of these people so that there's an absolute quality of life, not just people that are existing on the margins. And this is something that has been worked on by the gentleman sitting right beside me. This is Michael Maniscalco, who is the Chief Operations Officer and Chief Compliance Officer for Heartbeat International Foundation, a very important organization that's now saving thousands of lives, and congratulations,
Thank you.
Michael, for that. And also, we have a patient coming in. Hopefully she'll be here as far as we're concerned from Trinidad and Tobago. Coming in by Skype, and actually she's a 22-year-old patient that actually has gone through the Heartbeat International project there in Trinidad, Tobago. And so we're still waiting for her to come up. So we're going to, Michael, we're going to kick off with you. So tell us a little bit about this relationship with this EP Rewards, and then also about how you're actually involving and tracking the people like a Christine over these years, so that as they come up and they need to have new equipment and the latest technology, that they're actually able to get that in a timely manner.
Sure. Well, EP Rewards is an organization in Florida, a company in Florida, whose business is to recycle catheters. There are various types of catheters, but they contain valuable materials, such as platinum and other metals. Once a catheter is used, if it's not re-sterilized, it needs to be thrown away or hopefully recycled. So they maintain value after they've been used. And rather than have them wind up in landfills as medical waste, EP Reward is able to extract the precious materials from these devices, put those materials back into circulation in an environmentally sound manner, and disposing of those parts of the catheter that can't be reused in an environmentally sound manner.
Now, looking at these pacemakers and then the catheters, and of course there's other technologies, equipment that you're bringing in and recycling and doing all that. You've done almost 15,000 as far as these implants are concerned, and now you're expanding into other areas. So how does that evolve over time so that you have this managed but total health care as far as the heart is concerned in many of these, what we would say are emerging economies?
Well, I think Heartbeat was founded on the premise that there are people everywhere around the world that need a pacemaker or an internal defibrillator. We set up these operations, these heart centers, to operate year-round by local professionals in their countries, and they've been doing so for decades in some cases. Those individuals are best positioned to tell us what else they need done in their countries. So, for example, in a place like Trinidad, there's a 3-year backlog of echocardiograms. The folks in Trinidad have identified this challenge for us, and they're the ones who can help lay the groundwork with the other parties in Trinidad to create the possibility for an organization like Heartbeat International and its partners to design a project or a program to contribute to alleviating that backlog, for example. In Guatemala, it may be a completely different issue that needs to be addressed. So the idea is that by having this on-the-ground presence, we can build the local partnerships, prioritize the local needs more effectively than we could do from here in the United States. We're relying on in-country professionals to do those things for us.
Well, Michael, you're saying what's critical, it's really critical to Heartbeat International, is that you have, at least one professional that's full-time working on this almost 24/7, 365,
yes.
which is a lot of responsibility when you have one or two people doing that. So what kind of skill sets do they need to have before they come in and they're working on a full-time basis with Heartbeat International? And then how do they grow and mature in this? Because you're a not-for-profit organization, and that's very different than a for-profit organization in how you manage and cajole and direct and lead and identify new resources.
Well, I think the biggest skill, if I can use that word, would be a passion for the mission. Somebody who understands the need and can see the results of the work that we're doing and can be inspired by that will probably be pretty effective at getting through the grinding part of this job, the paperwork, the phone calls, all of that stuff that needs to be done can be tedious at times. But if you rely on the passion of the mission, it can drive you through that to allow you to build those relationships with, the Cardiology Society of Bolivia, for example, so that every cardiologist knows that this program exists, so that a patient doesn't get missed.
Yeah. Now, looking at these people in country, how do you identify them and what kind of skill sets do they have actually before they ever come to Heartbeat International, so that they really are the best fit, so you have less ramp-up time as far as them being involved and then reaching into these various professional associations, as well as Rotary International, which seems to be really a linchpin in many of these countries as far as expanding and reaching out to the public and bring them in to the operations of Heartbeat International.
I think one primary skill that we'd like to see is some experience and success in fundraising. I was mentioning earlier that this is a major challenge for our organization here in the United States, but also for our colleagues overseas. So if we see someone with some skill in fundraising, especially if it's in the healthcare environment, that's somebody who's going to be well suited to one of the biggest demands of this job.
Looking at this recycling and identifying with the manufacturers, I would say primarily in the United States, that have these various specialized technologies, how do you reach in and get them involved, and what are the numbers? Is there very few manufacturers, or is there a wide choice of manufacturers, for these various technologies needed to deal with heart?
In the United States and Europe, there are 4 or 5 primary global manufacturers, and we've been fortunate enough to be supported by all of them, either financially, or with product. Companies like Biotronic and Boston Scientific, St. Jude Medical, Medtronic have all supported us over the years, and we thank them for that support, and we need it to continue our mission. There are a few smaller companies in the developing world, in India and in South America, that are beginning to make pacemakers as well, especially single and dual chamber devices, which are a little less sophisticated than the more modern multi-chamber devices or the latest ICDs.
Right.
But these are the types of the devices that are needed by about 90% of the patients that we typically serve.
So actually, by having this feeder system from within the developing world itself, going right into those people's within the developing world, really is a good fit for you.
Could be a very good fit. We have yet to receive donations of products from these companies. It's something that we are very interested in seeing happen, of course. And yes, it would be a great fit for the economic development and operation of the Heartbeat mission in those countries.
Now, looking at the quality control, this is something as Chief Compliance Officer you're wonderfully involved in as far as the compliance, but also these audit trails that you really were mentioning earlier. How do you, in working, say, with the countries in Latin America and or in India, how do you do that same due diligence to make sure that everything is in compliance and that when the patients are receiving these, they're getting something that's a perfectly good, legitimate piece of technology, and not something that just didn't get sold or what have you? How do you really guarantee this quality?
Well, it starts with our donors. It starts with the manufacturers. They of course have an interest in making sure that the products they are giving us are good products. They want to be sure that they avoid any issues with reputation or patient care or things of that nature. So
because their names actually are still on that technology when it goes out, whether it's being installed as a humanitarian project, nonprofit, or it's going into something that'd be just something that's paid for as a normal, patient under insurance care or something like that.
Yes, I think it's fair to say that the manufacturers make sure that they give us good product. Our job is to fulfill the requirements that the manufacturers ask us to fulfill in terms of making sure that those devices get used for the right purposes, which is for an indigent patient, in the right way medically, and that everything is tracked and reported. At the end of the day, we're relying on our partners overseas. We have a robust compliance program that everybody has to follow. It involves a lot of forms, a lot of reporting, a lot of tracking. I may not have a lot of fans out there because I'm bugging people for this information all the time, but I'm feeding it back to the donor. Without them, the mission evaporates. So at the end of the day, we're relying on the goodwill and the expertise of our partners overseas to make the right decisions and to report everything back to us accurately.
Looking at the physicians, this is something that we've actually hinted at all this, but many of these physicians are actually giving their time. I mean, this is very valuable time that these physicians are donating to Heartbeat International and to the patient, him or herself. So how do you identify those, and what are they getting out of it? What's their motivation to do something like this at absolutely no pay?
Well, I think Heartbeat International is blessed to be able to truly say that we're working with true humanitarians all around the world. I think without exception, the physicians we work with derive personal satisfaction from doing the right thing and from doing good. And we're happy to have them as part of the team for that reason and for other reasons. So I think they share the humanitarian outlook, and they understand the value of the mission in a way, in a more powerful way than we do here in the United States, because they see the results, they see the families of the patients, they see the patients themselves, and they can have that interaction and really feel that impact. So that's probably the biggest thing there.
We have about 15 seconds. Where are you going to be in the next 5, 10, 15 years in reaching into these communities and overseas areas over that period of time?
Well, we're going to be expanding in all the countries we operate in now. We're blessed with hundreds of devices that are available right now in Trinidad. Our focus will be on setting up new locations to implant devices.
Oh, that's absolutely fantastic. Well, we're sitting here with Michael Maniscusco, who is the Chief Operating Officer and Chief Compliance Officer of Heartbeat International. And they're headquartered in Florida in the United States, operating in a number of countries overseas and specifically in Latin America. And thank you for being with us as we look at this new way of providing healthcare services, technologies, as we create the Emerald Planet.
I need a job.
Necesito trabajo.
I would like to speak English better.
Me gustaría hablar inglés mejor.
I want to be a U.S. citizen.
Quisiera ser ciudadano de los Estados Unidos.
For over 35 years,
Por más de 35 años,
the Hispanic Committee of Virginia has been serving our community.
el Comité Hispano de Virginia ha estado sirviendo a nuestra comunidad.
Job training and placement,
Capacitación, ayuda para conseguir trabajo,
education for children and adults,
educación para niños y adultos,
immigration, naturalization, and medical referrals.
ayuda para los procesos de inmigración y naturalización y orientación sobre médicos
Are a small part of what we do.
son solo una pequeña parte de lo que hacemos.
For help, information, or to volunteer,
Para ayuda, información o para ofrecerse como voluntario,
contact the Hispanic Committee of Virginia,
comuníquese con el Comité Hispano de Virginia,
helping everyone participate more fully in American society.
ayudando a todos a participar plenamente en la sociedad norteamericana.
Hey, Lena, where's yours?
Would you notice if you were missing half your kidney function? According to the National Kidney Foundation, 20 million people have chronic kidney disease, and 20 million more may be at risk and not even know it. Anyone with high blood pressure, diabetes, or family history of chronic kidney disease is at risk. Early diagnosis is vitally important. To get the whole story, talk to your doctor and visit the National Kidney Foundation at kidney.org or call for a free brochure. Because when it comes to chronic kidney disease, you might not know the half.
We're back to the Inside Scoop Emerald Planet. Here again, your host, Dr. Sam.
Hello and welcome to the Emerald Planet as we come to you from Washington, D.C. in the United States as we look around the globe in 144 different nations, looking for those 1,000 best practices, the technologies, services, and products, and of course the people that are making a difference as we move through the 21st century. And as we go to a planet with 9 billion people, we need to be much more judicious as far as the natural resources and the technologies that are actually being created at this time to bring about an increasing quality of life. I'm Dr. Sam Hancock, the President, Executive Director of Emerald Planet, and Director and host of the Emerald Planet TV as we come to you on a weekly basis. We have two gentlemen that are looking at this whole issue of healthcare and tying in education as we add these 2 billion new people to the planet. The first gentleman's coming in by Skype from Mexico City, Ariel Garcia. He's the Chief Executive Officer of Heartbeat International of Mexico. And then sitting right beside me is our special guest, Michael Maniscalco, who is the Chief Operations Officer and Chief Compliance Officer for Heartbeat International Foundation, and they're headquartered in Florida. Mr. Garcia, I think you're here coming in by Skype. Welcome to the Emerald Planet TV.
Thank you very much, Sam. It's my pleasure to be with you guys today.
And I understand from Michael that you are a very active Rotarian, a Paul Harris Fellow. I can see your pin, and I have my Paul Harris Fellow pin on as well. So it's good to see that we have Paul Harris well represented here in this television program. Tell us, Mr. Garcia, just a little bit about your work there in Mexico, and what are your duties of Chief Executive Officer for the Heartbeat International of Mexico?
Well, first of all, thank you very much, Sam, for having me in your program today. As you know, Heartbeat International started its mission in Mexico over 20 years ago. Dr. Henry McIntosh and Federico Alfaro and Dr. Rafael Meneses from Mexico realized that the great need of Mexico's population had of devices for patients with heart arrhythmias, and began this beautiful project. I was designed the CEO for Heartbeat International Mexico a couple of months ago, and I'm starting to gather all the implantation centers in Mexico. We're starting a very strong public relations program, so every doctor in Mexico knows about this project, this beautiful project. We're working very hard on that.
Well, understand that you're doing outstanding work there, and being on a full-time basis is very critical to Heartbeat International so that you establish these relationships, and this is something that's ongoing. And I think we have a photograph of you here with some of your Rotarians getting ready to really enjoy the day, and if you bring food, people are going to show up and get involved, so we're glad to see this. But how many heart centers and implant centers do you have in Mexico, and why that number for the size and scale of a country like Mexico?
Okay, we actually have one national heart center and 4 implantation centers in Mexico, Monterrey, Saltillo, Aguascalientes, and Puebla. However, 3 new implantation centers are coming soon. Mexico City, which was already working a couple of years ago and is getting reactivated, Chihuahua in the northeast of Mexico, and Veracruz in the Gulf of Mexico. With these additions to our mission, we will have 7 operational heart centers involving 14 hospitals and a team of over 100 health professionals like physicians, surgeons, nurses, and administration personnel.
Yeah, looking at the Rotary International, and then I'm going to have actually Michael ask the next question. Tell us a little bit about that relationship between Rotary International and Heartbeat International in Mexico. It seems like there's a very close working relationship there.
Yes, indeed, Sam. The basic relation started with our first implantation center. Dr. Meneses, Rafael Meneses, is a Rotarian, and the 4 implantation centers we already have are being run by Rotary clubs. So they got very, very much involved in this mission because, as they tell me, because I was very young when everything started, they said that the first patient that came to Dr. Meneses saw his Rotarian pin, and he was a Rotarian also. So Meneses started to talk to him about this beautiful mission of Heartbeat International, and they founded the very first implantation center in Mexico City, which is the Aguascalientes Heart Center. So from then, the Rotary International and the Rotary clubs have been working really closely with us.
I tell you, I think it's absolutely fantastic, and I'm going to mention this back at my Rotary Club of Washington, D.C. about your project there, and see if we can get some collaboration with you down there in Mexico. Michael, won't you ask the next question?
I'd be happy to. I'd like to thank you for mentioning this project to your club, of course, as well. But Ariel, thank you for joining us today.
Thank you, Mike.
I wondered if you might take a minute to talk about some of the other partners and collaborators that you'll be working with in Mexico in the years ahead to help spread the word about the Heartbeat mission.
Yes, of course. We have, obviously, the Rotary International plays a very important role in our mission. Caritas, with all the social work, Caritas is a very international organization. And of course, all the private hospitals we provide implantations at. I must say we work with some of the best hospitals in Mexico with very well-trained surgeons. We're also having new relations with el Instituto Panamericano de Cardiología. They have a very large mission in all Mexico because they gather the most of the cardiovascular physicians in Mexico City in this association, and they are very willing to work with us in spreading the word about what we're doing and about Heartbeat International.
Well, I tell you, that's very important, Mr. Garcia, to have that. Tell us, what are some of the measurable impacts and outcomes that you have there for Heartbeat International in Mexico since this program started, say, almost 20 years ago?
Well, over 700 pacemakers have been implanted with an impact in the same number of families. 700 mothers, fathers, grandparents, and even children that are running and studying right now. And if you could measure this in terms of money, we've had an impact of nearly $20 million. $20 million that these people didn't have and will never have to pay. Isn't it awesome?
I tell you, that's a huge impact. Now, you were just talking about the follow-up work you're doing as far as with the Rotary clubs, but also the question that Michael asked about this collaboration with other programs and organizations. But what's some of the activities that you're actually implementing there in Mexico that's allowing you this tremendous outreach to all these professional organizations, within the physician community itself, but also into the community as well?
Yes, the role that these international organizations are going to play with us, it's going to have great impact. This Pan American Cardiovascular Association is going to provide us with information, and it's going to provide all the doctors with information about Heartbeat International mission. And this is going to open many doors for us in terms of reaching foundations, important foundations like Carlos Slim Foundation or Telmex Foundation, and it's gonna bring us a great scope in the whole country. So I think it's very important.
No, I think that's tremendous, and that's a testament to the hard work and leadership that you're providing there in Mexico, because as Michael was telling us, you really need to have someone that's in the country, it's very much engaged and doing it on a day-to-day basis, which just expands tremendously the outreach, but also the impact of Heartbeat International. Michael, you have the next question.
Yes, Ariel, I wanted to ask you if you could offer your thoughts and perspectives on some of the challenges that you face in implementing the Heartbeat mission in a large country like Mexico that may not necessarily be present in a smaller country.
Okay. Yes, Mike. Well, I guess living in a 110 million people country where the 50% of the people is poor and live far away from the great urban sites is the biggest challenge against a smaller nation, for example, Trinidad and Tobago, is the how to get to them. So we're working closely with other humanitarian organizations, like I mentioned, like Caritas and Rotary. So they help us identify the patients and bring them to the cities, and then we perform the implantations. I guess it's the distances that in some cases the people has to travel is one of the biggest challenges. Yes. But we're working on that.
Yeah, looking at the interactions that you have with the hospitals, I know this is something that's absolutely critical to your mission there, Mr. Garcia, and you really have to establish these long-term relationships with the physicians. How do you manage, well, one, make those contacts, and secondly, how do you manage those so there really is a long-term system where, you know, year after year after year, you're going to be able to bring in these patients from the countryside and be able to put them into these very sophisticated healthcare centers?
Okay, well, like Mike was mentioning a couple of minutes ago, we work with very, very committed people and very committed organizations. We look always for the benefit of the patient, and we go to the hospitals and we sign the agreements for long-term, for providing long-term care for all the patients. The physicians, and none of them is Rotarian, that's a very important thing. The physicians are very compromised and very committed with our mission, so they work with us without hesitation.
Well, Mr. Garcia, we're going to lose you. We just absolutely ran out of time. Thank you for being with us. Ariel Garcia, Chief Executive Officer of Heartbeat International. And Michael, thank you very much for being with us on the Emerald Planet TV. And thank you, dear viewers, for being with us as we look around the globe to create the Emerald Planet.